Hello everyone, this is Dr. Suraj. Today's topic is subclavian steal syndrome. So before going to understand the subclavian steal syndrome, need to remember the branches of arch of aorta. Branches of arch of aorta. So you have branches, the first branch is brachiocephalic artery or brachiocephalic trunk. Next, you have left-sided common carotid artery and left-sided subclavian artery. The right-sided common carotid artery and right-sided subclavian artery are not directly arising from your arch of aorta, rather they are arising from your brachiocephalic trunk. So right common carotid and right subclavian artery, they are direct branch of brachiocephalic trunk, they are not from the arch of aorta. So let's identify those arteries. This is the arch of aorta, you can appreciate. From here, the first branch, this is your brachiocephalic trunk. This is the next branch, that is your right, that is your left common carotid, and then this is the third branch, that is your left subclavian artery. Okay, this is the brachiocephalic trunk, which is further giving rise to right common carotid and right subclavian. This is right common carotid and this is right subclavian artery. So once we know that, then the further understanding is vertebral artery. The vertebral arteries, they are the branch of the subclavian artery. So the right sided subclavian artery will give right vertebral artery, and the left side subclavian artery, the left sided will give left vertebral artery. As we know, so both the vertebral artery join together to form basilar artery. Basilar artery. Okay, and this basilar artery will give further branches, and the last branch will communicate with the circle of Willis. So here what you need to remember, what is this subclavian steal syndrome. So that means in the subclavian artery you have a stenotic segment here, you can appreciate, and this stenotic segment is present proximal to the branch of vertebral artery. So the subclavian artery is giving a branch, that is your vertebral artery. Before giving that vertebral artery, there is stenosis. So what happens? Because there is stenosis, the subclavian artery will not supply your upper limb. Okay, the ipsilateral supply to the upper limb is decreased. So when the patient is on exertion, or when that ipsilateral side is there is activity, what happens? This opposite sided vertebral artery, which is carrying blood to the brain, actually this blood is diverted. Actually this blood is diverted to that ipsilateral arm. So this blood that should go to brain and maintain the cerebral perfusion, this cerebral perfusion is hampered during the ipsilateral arm activity. Okay, so that the patient will be presented with vertebrovascular insufficiency, dizziness and vertigo, and also that affected arm will be having pain and paresthesia, and there will be ischemia of that arm. If you note blood pressure on both the hands, you will see there is marked difference of more than 15 mmHg systolic BP. This many times associated with arteriosclerosis, and subclavian artery is most commonly involved in which vasculitis? Takayasu's arteritis. Okay, so these are the things you need to remember. Here you can appreciate that stenosis of the subclavian artery proximal to the origin of vertebral artery, that leads to hypoperfusion distal to the stenosis, so reverse blood flow in the ipsilateral vertebral artery, which in turn actually causes compromisation in the cerebral perfusion on exertion of the affected arm. This is what is your subclavian artery steal syndrome.